Small bowel transplants, very rare, especially in adults. Only 70 to 80 intestinal transplants are done each year in the entire nation. In tonight's Health Alert, a Maryland mom who made it through that and then went on to have a baby. Tasha Alston is now a proud mother of 2 little girls, but it's been a long and arduous road getting there.
Well, back in 2004, me and my mom had got a gastric bypass surgery done. And as a complication of my surgery, I had to have a small bowel transplant.
Did well after her bypass. She lost weight, and unfortunately, she had a twist in her bowel, and that choked off the blood supply to her bowel.
Transplant surgeon Dr. Cal Matsumoto and his team at Georgetown Transplant Institute successfully gave Alston new functioning intestines so she could continue with her life. The Fort Washington woman already had a little girl but knew she wanted more children. She got pregnant just over 2 years after her transplant.
I let the doctors know, and they said, okay, well, we're going to see how this plays out.
That's because these transplants are so rare. Tasha is only the 2nd woman in the United States to give birth after a small intestine transplant. Her OB/GYN immediately categorized her as high risk. Dr. Helene Landy says complications can arise depending on the organ that was transplanted and the medications needed.
Because they can have various effects on other parts of the body, and we're worried about, for instance, kidney function, or are they having any anemia, and those things can have an impact on a developing pregnancy.
Dr. Landy stayed in regular contact with Tasha's transplant team. Some of them were even in the delivery room in case of an emergency. But that wasn't necessary, and baby Taylor came into the world ahead of this holiday season.
And she was healthy, and we are very, very blessed and thankful for that.
Small bowel transplants are done mostly in young children, and they continue to get better and better, more successful. And doctors predict in the future that will lead to more and more recipients delivering healthy babies just like Tasha did. But she's a pioneer.